As a journalist who's been interfacing with and observing people and human behavior for nearly 15 years, I would definitely say I've noticed that it's more socially acceptable to talk about mental health. So seeing that growth has been amazing. However, there also still definitely is a real subset of people who still are either uncomfortable talking about it, admitting they need help, and then going out and asking for help. At the end of the day, the way that things become more comfortable for people to talk about and more conversational and societally accepted, if you will, is very simply put for more people to talk about it. You know, I think it was interesting to learn that as humans, we all often have the same kinds of struggles, but the way that we react to those struggles are different, of course, because we all have different life experiences that inform our human behavior. But more than that, we also don't always all have access to the same kinds of resources. One group we wanted to focus on in this episode was young people. As we know, mental health is such an important conversation for teens and preteens, and we went and talked to one of the school districts to see what they're doing to help kids navigate these really difficult conversations. Wow, we are inside the Wellness Center at Rancho Mirage High School. It's new. It was just opened October of 2023. It's absolutely beautiful. Take me around.
Yeah, so when students come in, we're basically checking in with how they're doing. They tell us why they're here, whether they're tired, sad, upset, and what they want to do with their time here. Students have a choice of wellness center time, which is kind of self-directed, or we provide them with someone to talk to. So it could be a counselor, myself, or just depending on what their situation is, someone who can definitely help them with that. They have things to choose from right here. So we have puzzles, coloring. High schoolers love coloring.
Wow, yes.
Little magazines for them to read, writing. We try to provide them with fidget toys, just things to help them sit.
Just calm
and
down,
think,
right?
Yeah, and calm down. Most students, when they come in, they're talking to adults. Sometimes they like to sit on the floor. So we try to provide them with lots of different seating options. We have a coloring wall for them. Basically, again, just let them dictate what they need to feel better.
How many students are typically in here at a time?
Usually between 8 and 10 students per day.
Throughout the course of the day?
Throughout the course of the day. Usually 1 or 2 at a time come in. And students request from their teachers, I need wellness center time. They get a pass and they come in and they talk to whoever adult is in here first.
What is in here?
So this right here is probably our students' favorite room. This is, I call it the comfy room because the best seating is here. I always, students ask, they're like, well, where's the best place to go? And I'm like, sit down in this rocking chair. It's nice, big, comfortable. We usually have some sort of calming feature and music playing.
No cell phones?
No cell phones.
Right.
No, we tell students, hey, put your cell phone in the basket. We just want you to really focus on yourself and have no distractions and everything. So students really, they really like that because, again, it lets them sit, kind of close their eyes, and they don't have to worry about notifications going off and everything.
And this is another, right?
Yeah. So a lot of times students will sit in the chairs, and as they're just thinking and processing what they're going to, they mess around with the sand.
It's interesting. I like that you don't allow cell phones in here. So many times we think, I just want to relax, and we pull out our phone, we go to Instagram, and it's just so anxiety provoking. We don't even know it. It's just comparison and all the things, right?
Yeah.
So just getting a chance to sit and be without your phone is so important.
Yeah, and it's really important for our students to be comfortable with their own feelings and taking the time to process their feelings, to, understand why they're upset or why they're feeling the way that they are, or just, again, kind of zone out and give their body and brain that rest.
It was mind-blowing to see what Palm Springs Unified School District has created for young people, these elaborate, state-of-the-art wellness centers full of anything you can think of to help calm young people in times of angst and anxiety and stress throughout the day. Danielle, we are sitting inside this beautiful wellness center here at Rancho Mirage High School. It's truly stunning, and I understand these are sprinkled all throughout the district schools. Let's just start with the concept behind implementing wellness centers in schools.
We have wellness centers on about 10 campuses right now. We've got more coming online, and the ultimate goal is for every campus in the district to have a wellness center at their site. And really, I mean, what you can see here is this very calm environment. It's a little bit of a break from your day. But we also have resources available for students as well. When they come in, we talk with them about why they're here, what their needs might be, and help direct them to the right resource, whether it is maybe some sort of wellness resources, just coping skills, some of those kinds of things. If they need to be connected with a mental health specialist, a mental health therapist, somebody who can help them individually work through whatever those stressors might be. We also sometimes conduct groups in our wellness centers. So if there is a topic that a certain group of students really, we notice that there's a trend, that there's some sort of a need, we'll have a group scheduled in the wellness center as well, so that students can get some education on that topic, but also get some support from their peers and from a staff member who is educated in that particular topic, so that we can help them work through whatever needs they might have for that as well.
So the first wellness center opened essentially after the pandemic, but I understand you're saying these weren't a direct response to the pandemic per se, more of a growing issue.
Exactly.
What is that issue? Is that social media?
I think social media has contributed to it, absolutely. In terms of my role with the school district, I think what we see is we see a lot of anxiety with students. We see a lot of relationship stress, whether it's family relationships or peer relationships. Social media probably plays a role in that. And I think also just our access to information that we have. There's always something coming at us anymore now. And so I think especially students, young adults, it's just so overwhelming for them sometimes, trying to manage family relationships, trying to manage peer relationships, trying to look at what their future might look like. All of that together really increases a lot of anxiety and a lot of worry. So really what we need to do is help our students put all of those things in context sometimes too, I think.
That quote that says, comparison is the thief of joy. And granted, growing up without social media, we still compared to maybe girls in the hallway, but generally speaking, we were all semi in the same socioeconomic situation, right? Nowadays, kids are comparing themselves to Kylie Jenner and the richest of the rich, the prettiest of the prettiest, the filters, right? And so,
the influencers.
Yeah, I mean, there's just, like you said, too much information that I would imagine is just so overwhelming.
And when I'm working with students, when we're talking about those kinds of things, I always have to remind them, when you're looking at those things, when you're seeing those things, you're seeing that person's highlight reel of their life, right? You're not seeing their struggles that are behind that. You're not seeing their everyday life. You're not seeing what people they have in their life, what support systems they have or maybe don't have. You're just seeing a little snippet of what's going on, right? And that has been polished and produced, whether it's one of your peers or it's Kylie Jenner, right? You're not seeing what's really going on behind the scenes. And it takes so much time to help them understand that, because as much as you say it, there's so much internalizing what they see and what's going on.
Some issues with kids 100% warrant the attention and this space, and they need to be in here. Presumably, some people also argue the other side. Nowadays, kids are too coddled, and these conversations about mental health, some of them use it a bit too much. I'm curious, how do you find that balance?
What we've worked on doing and what we've really tried to do is make sure that there is a purpose to this space. When a student comes in and they do just need some downtime, we make sure that we have somebody that's checking in with them. we can make sure that they have some wellness activities, even just some mindfulness activities to help them recenter themselves so that they're in here for a purpose. They're not just here to, hang out and get a break, right? That they realize that when you're coming in here that you have a need and we want to help you meet that need too.
Right.
Because we do hear that, why are they leaving class or, some of those kinds of things. And from my perspective, it's important that they're here to learn, right? That's why they're in school, and that's true. But if they are so overwhelmed by whatever is going on in their life, that they're not focusing, that they're not getting what they need to learn, then they have this space.
Right.
But we need to partner with the educators to make sure that everybody understands what the other one is doing too.
What should parents look out for to kind of know that their kids are really dealing with stress and anxiety?
One of the things that I can say is just try to keep open conversation with your child. I know that's hard with teens. They don't always want to talk to us, right? But really keep that connection, keep those conversations going. And it doesn't have to be anything formal. It really can just be moments in the day where you're having conversations with your child.
And I think we can't underestimate the importance of having a strong family
Right.
bond. I mean, at the end of the
Absolutely.
day, I think that's what kids need and
Right.
want. And if they're
Yeah.
acting out, it's oftentimes to get attention from
Right,
mom or
they're
dad,
looking for
right?
some of that connection too.
Yeah,
Right.
yeah.
So, but if they do express a need, really just reaching out to the resources that are out there, to your healthcare agency or to your student's counselor or a teacher that they may have a good relationship with, because they do have connections with other adults in their lives too that they might feel more comfortable with as well. So.
And I know other school districts, if parents are watching, whose kids go to other districts, they have
Right.
other mental health resources as well. But
Absolutely.
I love that PSUSD's created these rooms. This is beautiful, and I just feel the calm. So thank you for creating these for the kids.
Thank you. Yeah, we very much appreciate having this space for our students.
The Bianca Ray Foundation, my nonprofit that I started more than 10 years ago now, really also focuses on bettering the mental health states of young people, much like what these wellness clinics aim to do with PSUSD. Something I hope these young people learn from, whether it's the Bianca Ray Foundation Rave Hope Retreat or these wellness centers at PSUSD, is that everything is inside of them. I tell them stories specifically about celebrities and notable politicians who overcame severe adversity and grew up in poverty, because the reality is they were not able to rely on external factors to succeed. So I try to inspire kids who don't have those external factors to know that they have so many internal factors, because we've seen it done time and time again. We look at certain celebrities or politicians who grew up with nothing and created so much. When these young people go into these wellness centers, I hope they just take away the knowledge that everything is inside of them. They have so many things internally that could help them overcome, whether that is life circumstances and poverty or anxiety and stress and mental health struggles as well. The mind is a fascinating, incredible, powerful thing. And we have more within us than I think any of us are aware of. So for these kids to learn mental toughness and mental prowess at a young age, I think is critical, and that could help them turn their life around. Desert Oasis Healthcare recognizes clearly the importance of mental health, because they have an entire behavioral health team available to their members, whether it's psychiatrists or therapists. They're readily available for anybody who needs help. We spoke with Carolyn, and you could tell she brings her work home with her, people that she's seen for decades, and watch them grow. And it's personal to her. You can tell that helping people experience personal development, personal growth is personal to her. And that's been a common denominator in so many of the healthcare providers I've interviewed during my time here with the Pulse, who work at DOHC, is caring on a personal level, like a real family level, about their patients. I understand you've been working in the mental health space now for nearly 4 decades. So congratulations on just such a studied career. It's been incredible. Just speaking with you, I could feel your passion.
Oh, I love the work.
I'd love to start this conversation on mental health. First and foremost, just giving people a really genuine, accurate understanding of therapy, because I do believe in some cultures or maybe different generations, there's this thought of therapies for crazy people and I don't need it. And that could be further than from the truth.
Mm-hmm.
Can you share with us the true definition of therapy?
I think therapy is the ability to engage with another person and help them see themselves and get to the best of who they can be. So most of us suffer and hurt. And when we're doing that, we don't feel good, but we don't know who to turn to. Sometimes we turn to our friends, and culturally in the Hispanic community, comadres are meeting together and talking, but they may not have the answer. They can be supportive, but it's not teaching them skills on how to deal with their situation. So I help them look at a perspective differently. Very simple. I say to, like I would say to you right now, Bianca, what do you see behind me?
I see planters and a building and some cars in the parking lot.
You don't see anything I see. And so it's a simple thing that we have our different perspectives, and yet we want people to think just like us or feel like us, and it's impossible. So what I do is I would literally move myself in my office, maybe 5 feet from where I am, and then I ask them the same question. What do you see? They don't see the same thing. And what I say to them, therapy is you changing. Don't change the world around you. You have to change yourself. And if you change, the other person will see you differently, and you will see things differently. And that's the key. We have to adjust, and we have to adapt, and we have to be resourceful and definitely resilient. Life is difficult.
I understand the patients you predominantly see here at DOHC have severe mental health issues, whether that's depression, bipolar disorder. The reality is, just so we paint a clear picture of therapy, some people need to come to therapy for just the most basic of reasons of struggling to get their teenage child to open up with them, or struggling with their spouse. Can you explain some of the other reasons why people might go and see a therapist?
People come in because they're having difficulty with their spouse, let's say. At different stages in our life journey, we have to surpass certain obstacles. Say a woman becomes pregnant, has her baby, and can't figure out why she's depressed now after having the baby. Well, we have chemical imbalances that happen to us, hormonal imbalances. We have men that go by age 50, they start going through their own cycle. When men retire, they have no job anymore. They are not engaged with anybody. They may not even have any friends. And so all they're doing is the same thing they ever did, cut the lawn and take out the trash. And so they feel very empty, unfortunately. They go into a depression. They don't realize that's what it is, so they can do drinking, have an affair, do other things that are very destructive to their family system. So a wife will come in and say, something's changed in my husband. He doesn't talk to me. He's kind of mean to me now. So they come in because they're saddened by the lack of communication or understanding what's going on.
Moving along to, I understand the Hispanic community, what are some of the cultural barriers you see when it comes to the Hispanic community and mental health?
Well, one of the things for families is you don't want to share your laundry, and I think that goes with most cultures. So you don't want anybody to know something's not going well. You have the machismo still exists, especially in our area, because there's just so many new immigrants. So what happens is the wife may be having a problem. Some people come to me and don't even let their spouse know because they feel they're going to say they're crazy. The other is I have men who come to me or sent to me because they've been drinking, they've gotten in trouble, and that has been something that's been very helpful for them to understand there is another way to deal with their problems.
Do you see an evolution in more people reaching out for help? Is therapy becoming more societally accepted across all generations and cultures?
I think so, but I think it's coming from the necessity. I think people are hurting more, and so in light of that, they get referred earlier on. And so with that, we can help them try to churn the curve. It's skills building.
When it comes to mental health, what are you most proud of that DOHC offers?
I think DOHC, in all my 40 years of mental health, I am so pleased to be working with them because we have the best continuation of care. So if someone is sent to me for immediate intensive therapy, I have at my disposal through the organization, I have case managers that can follow up, case managers that can help people with benefits. I have social workers that can help people with rehab. And so we have the whole gamut. We have crisis center, we have after hours nursing and information, medication, pharmacists. So even in my group of men and women, Spanish-speaking men, we can invite a pharmacist to come in and speak to them about their medication and how to handle their medication and not to share their medications with other people. So DOHC is actually got the best program I have ever encountered.
Some of this help we're talking about is highly specialized, right? Whether it's at a school for a child to seek out or a therapist for an adult or even a teen to seek out. But sometimes people aren't as inclined to go out and specifically ask for that one-on-one help. So when you see these community-wide events just offering help to people in a bit more of an approachable way, it's really powerful to see. So Riverside County put on this mental health awareness fair with all these different nonprofits and organizations represented with a bunch of pop-up tents, just giving out information. And I talk about the power of taking one brochure because you can truly, I've interviewed people who said their life has been changed by just having the nerve to take one brochure and inquire about a little help. And sometimes in these kinds of settings, it feels a bit more approachable, a bit more comfortable for people than maybe seeking out a therapist or calling somebody one-on-one. Rather, you're walking around a community event, you stumble upon a tent, you grab a brochure, and maybe that's the start of it for some people. Well, we are here at the Art of Wellness event, and I love, Shannon, how you said it is an art to be well and take care of yourself. Will you explain the meaning behind the name of this event today?
It actually happened quite organically on the committee. We have a committee of folks that assist us with planning these events, and we do them every year. And we like to come up with a theme. And this year, the theme was really around how being well is, it's very subjective. It's the person who has to decide how they're going to stay well. And, you know, the pandemic taught us a lot of things about wellness, taught us about how to care for ourselves, specifically around anxieties and around stressors. And being a person who works really hard to stay well is sometimes a chore, but instead, if you think about it as an art form, it's very creative. You have to use your creative mind to think about the ways that you're going to care for yourself.
You know, you compare yourself to people that can lead to anxiety or depression. You think of traumas within family members that can lead to something. The world maybe is set up not in a way for us to always think positively or act. It takes effort, right? It takes intention for us to be well and live well.
Yeah, it does. I think that folks, are becoming much more aware in the general public about emotional well-being, if you will, not necessarily mental health, because mental health sometimes has this stigma around it. And so to bust that apart, just to bust stigma apart, think in terms of our own emotional well-being and knowing that it sometimes takes work to stay in a really peaceful and an okay place to move through your life.
And giving yourself resources such as where we are today in this mental health awareness fair. Before we dive deep into the weeds of it, I want to take an aerial view because really the goal is to let people know, as you said, I'm going to quote you, it's okay to not be okay. And the more you talk about it, the more you come to events like this to see other people are sometimes not okay. That just fosters and breeds more awareness. Can you explain that aerial picture?
It's not just about understanding like mental health as something as technical, that's clinical. Understanding that compassion kind of should lead the way. I tell the people that I work with, and they tell it to me, is, you know, lead with love. And if you're meeting somebody at the heart level, you know, kind of like I'm meeting with you now, because we're not scripted, we're just talking to each other. And you could meet somebody who maybe didn't have a person to talk to for a long time, and you're just listening to them talk, sometimes that is a moment where a person can recognize that, gosh, if I had somebody more to talk to,
Yeah.
I might get a little better, I might feel a little better.
That compassion, that human connection, human awareness.
Human to human connection.
Yes. Some people come here today intentionally. They're eager to find these resources. Others might be accompanying a friend and they stumble upon a brochure. I'm curious, what is your goal for the day? Whether people came here for help or not, what do you hope they all take away?
It's to plant a seed.
Yeah.
We plant seeds everywhere we go, and these events can create gardens. I mean, these people who come here, who perhaps are reluctant to get help, they will think about it after they leave.
Bruce, we're here today at this mental health awareness fair, and there's so many people walking around all the different tables. Some of them you can see almost maybe hesitantly grabbing a brochure. You are living proof, though, that all you need to do is have the courage to ask for help, grab that brochure, and your life can truly turn around. When you look around here, I'm curious how you feel about just how far you've come in your mental health journey.
Don't be afraid to take a brochure. It's gonna help. There's stigma out there. Don't pay attention to it because everybody has problems and it doesn't matter what it is. You need to take care of yourself.
What brought you here today? What are you seeking?
Assistance with my father. He was recently diagnosed with Lewy body dementia, and I definitely need help. And one of my friends invited me to come and visit, and I'm so happy I did come.
Explain to me what it feels like seeing more people here.
It's comforting knowing I'm not the only one going
Right.
through this, because sometimes it just feels so overwhelming and like I don't know what I'm doing. But from talking to other people and some of the outreach programs, what I'm feeling isn't anything out of the ordinary. In
Right.
fact, it's normal.
Why is it so important that people ask for help?
Because they can put their mind at ease. You know, just one visit to someone would put that hope back in you. I do a lot of public speaking here today.
Yes.
And the one thing that they always say, like, what can we do? Like, just listen.
Why is it so important to ask for help when you need it?
Because it is very overwhelming. Not a doctor, obviously. Can't really help in that department. But having these services, knowing that they're here, and I think maybe just getting into it early so that at the very end, especially with my father, I'm not trying to gather this information haphazardly. He's moderate. This is a good time to catch it. It's not easy to reach out for help, especially when you don't know that there's help out there.
Right. As someone who's lived and worked in the Coachella Valley for a considerable amount of time, I think I've always known there's a lot of resources out there in the mental health space, but this was my first opportunity to have a behind the curtains look at those resources and truly see that it is completely a no judgment zone when you enter the space of personal growth, personal development, whether it's the Desert Oasis Healthcare providers, when you go to these large scale community events, they're truly people who welcome you literally and figuratively with open arms to the world of getting to know yourself better, because I think we don't know ourselves 3 months from now. We are ever evolving human beings, and the more we can learn about ourselves, identify our emotions, learn the things that truly make us tick as humans, the more peacefully minded we can all live in this world together.